nature of the First Deputy Speaker of Parliament. He's been extremely partisan this evening, disregarding the provisions of the standing orders of this House. This House has orders, and the order in 93.1 allows for issue of urgent public importance for statements to be admitted. Minority pleaded for him to exercise the highest form of discretion. But the First Deputy Speaker failed. I think the First Deputy Speaker has a lot to learn from the Speaker himself. The Right Honourable Speaker is extremely liberal, encourages the provision and the execution of the standing orders. But the First Deputy Speaker, who is extremely partisan, has denied us the right of the minority to exercise what we have to do as far as this strike is concerned. What did we do this morning? We met you and then made you aware of our position. But it doesn't end there. Our business is in the House. So we made a statement, a joint statement between myself and GRNMA, basically to get the hands out to capture our position. And that's the way we work. And from this, you can deliberate on it and then put the necessary pressure on government to do what they have to do. But that is official. Regardless of the press conference we had earlier, this is our work. And the only way to have made it formal was to go through an urgent statement. But he has refused that. He has refused that. When the order 93.1 allows him to have admitted this on issue of urgent public importance. In issues like this where people are dying, if this is not important, what's our business in the House now? Threatening that he is going to expel myself and my colleagues out when we're trying to plead on nurses to go back to work and also ask government to be reasonable with their posting towards nurses. What else do you expect from a minority? A reasonable minority. A reasonable minority who are not playing politics. Unlike them, whenever they had opportunity on health, they always play politics. A very reasonable minority here, we understand that nurses, their rights don't have to be breached. We understand the nurses are so right. But we are even pleading on the nurses that when government decides to